Hi, how are you guys doing? My name is Dr. Seun Adigun. I am a chiropractor and biomechanist. I specialize in injury prevention and rehabilitation. As a biomechanist, I do a lot of muscle testing, and I specifically use DorsaVi in my practice when it comes to collecting data. I work with a lot of active individuals, elite level athletes, and mostly professional athletes. I came today because I have a really interesting case that I wanted to share to basically show you guys how I integrate DorsaVi into my practice, and for other chiropractors out there, what that can look like when you have test results after treatment. So I have an athlete who is newer in his NFL career. His first time coming to me was this summer during the beginning of off season, after having had been in a boot on his right foot because he had a fifth metatarsal fracture and there was a screw placed in there. And then he had his left knee scoped. So what I wanted to do once he finally got out of the boot, it's completely cleared and ready to start training, I basically decided to start with hamstring testing. The reason I started with hamstring testing is because for me, pelvic mobility is one of the most important indicators of long-term health for a career of a football athlete, track athlete, just about any athlete. It tells me a lot about how the pelvis is moving, a lot about lower cross syndrome, a lot about how the glutes are firing versus how the hip flexors are firing, and whether you have a lot of activity happening in the quads versus the hamstrings. So this case study presents with a pre-test and then a post-test. In the pre-test, I basically did the hamstring test prior to doing any treatment whatsoever. So what you'll see is that the athlete was actually uniquely, almost completely symmetrical from the left to the right. He had 92 degrees of passive range of motion in the left hamstring and 93 degrees of passive range of motion in the right hamstring. Keep in mind that he had the left knee scope and he was in a boot for 6 weeks on the right foot. Then we look at the active range of motion. Again, almost completely symmetrical, where he has the left hamstring at 103 degrees of active range of motion and the right hamstring at 104 degrees of active range of motion. Both of these are well within what we consider to be the normal range of motion. Then we look at the speeds for his hamstring test. On the left side, it was 243 degrees per second, and on the right side, it was 245 degrees per second. Again, both of these very symmetrical and all within normal ranges of motion and speed. So after this test, I went ahead and did treatment on this young man. He presented with a left short leg, which was an indication that his left pelvis was anteriorly rotated. It was also a day when we did neuromuscular re-education to the glutes, to the psoas muscle. We flushed out his low back, mid back, both hamstrings, and both quads. We also released tension in his TFL bilaterally and in his adductor muscles using a massage gun, manual therapy, pin and stretch, as well as pelvic mobility while having the athlete laying prone and rotating his pelvis anteriorly to posteriorly in order to turn on the psoas muscle. So we did these workouts based off of him being cleared by his physical therapist and his orthopedist with this professional team, allowing him to go ahead and start ramping up his workouts. So this was after day 1 of him ramping up his workouts. He had been doing about 2 months worth of workouts that were modified or mostly focusing on balance, proprioception, core strength, and upper body strength. He was also isolating his quads and hamstrings as well as glutes during the different phases of his recovery, whether it was weight bearing or non-weight bearing, to allow him to increase his overall strength during this off-season time. So after we did this treatment, I went ahead and administered another hamstring test the same day. Now what you'll see, it's actually quite, for some people it might seem alarming, that in the same day, about an hour after doing the first test and after administering treatment, which essentially stabilized his hips and got his muscles to fire, all of a sudden all of his numbers start going all over the place. So in his passive range of motion on the left hamstring, we now have 95 degrees, which is better than the 92 degrees that he had. However, on the right side, we have 107 degrees, which is significantly higher than the 93 degrees that was during the pre-test. Then on the post-treatment active range of motion, where the athlete essentially kicks his leg up as fast as he can while keeping the contralateral leg as straight as possible, he had 94 degrees of range of motion in the left, which was less than 103 degrees that he had in the left during active on the first one. And he had 95 degrees of active range of motion on the right, which again was less than the 104 that he had in the pre-test. These were still similar, however, they were both significantly lower range of motion. Then we saw that his speeds also decreased. On the left side, he had 235 degrees per second, whereas originally he had 243 degrees per second. And then on the right side, he now had 227 degrees per second, where he had 245 degrees per second on the first pre-test. So one of the questions I asked myself was, why would we have numbers that are so different after having done treatment? You would think that his numbers would have increased, or they would have been a lot more symmetrical, or who knows, right? We thought that things would have at least gotten what would have presumably been better. Well, believe it or not, they did. They gave us a lot more information on what his body actually does. So before, in the pre-test, what we really saw was that this is a young man whose body is extremely good at balancing itself out. It is very good at creating equal compensation in areas where there is weakness. One of the lessons that I learned in this test was that the body is only able to go as far as the weakest muscle or the weakest range of motion, especially when it has to do with the pelvis. So as I mentioned to you guys before, he had a left short leg, which means that his pelvis on the left was tight and anteriorly tilted, which makes sense because he had been in a boot on his right leg for a lot of his off season, and so he spent a lot more time on that left side, essentially tightening up those glute med, the external rotators, all his pelvic stabilizing muscles on that side had been a little bit stronger than the right side, which we also were able to validate using other muscle tests. So once we released those muscles and released the tension in his pelvis and got his pelvis to now be in a neutral position, what we then realized is that he had more range of motion in the right side. It's just that that right side had to decrease its ability to move in order to try and balance out what was happening on the left. Because the left side was tight, the right side wasn't able to get to its full range of motion, which is why after we adjusted him, we really were able to see that he really only has 95 degrees of range of motion in that left side, but his right side has far more range of motion in the hamstring. We also have to consider that the hamstring test is accumulation of not only just hamstring flexibility, but also the firing capacity of the hip flexors, the firing capacity of the quads bilaterally, just because this is a straight leg test, and the quads will also be active for leg extension. This also is an indication of what his core is capable of doing, his strength in his core, as well as the amount of release that he has on his posterior chain from the glutes down to the hamstrings. So we're able to see again that his right side actually has far more range of motion, and what he needs to be working on is increasing the range of motion on his left side. He needs to increase his mobility on that left side by releasing tension in that glute, releasing tension in those hamstrings, and making sure that the glute is firing properly so the hamstrings are not bearing more load than they need to and creating more tension, therefore reducing the range of motion of that left hamstring. So that's on passive range of motion. Now when it comes to active range of motion, one can argue that these numbers are actually better than they were before. Although it appears that he had less range of motion in the left and the right, now they're actually balanced out because his muscles are now firing properly. When the muscles are all doing their job effectively, he is able to fire the muscles at the capacity in which they are able to perform and not overcompensating on one muscle group than the other. One can argue that in the last test, in his pre-test, he was likely recruiting other muscles in order to allow his hamstrings to get this test at 103 and 104 degrees respectively. Now we're actually getting a true indication of what his hamstrings can do because he's no longer recruiting other muscles to do their job. As far as the tension on the hamstrings indirectly, and a lot of that comes from the glutes. In this particular case, and on this day, his glutes were very hyperspastic, and you could tell that he had really kind of turned his glutes on. He had done Pilates earlier that day, and he had done some upper body lifting, but he also did some isolated balance and single leg strengthening. Another thing that I think is a good indication is that the fact that these speeds are slower. One of the things that we typically look at with muscle testing are how fast are muscles moving. So one thing in muscle testing that we find is that speeds are a good indication of how much control the person has of a particular muscle group. I think one of the really good things that we can take away from this is that with these slower speeds would also indicate that there are less speeds and eccentric load on that hamstring, which for most muscle testing scenarios, having more control means less vulnerability to injury, less vulnerability to pulls, less vulnerability to strains. So in this case, I think it's also that we're able to see by turning on his glutes, by releasing the tension in his psoas, by releasing tension in the TFL and the other hip flexor muscles, we were actually able to allow them to equally disperse their energy so that the amount of stress put on the hamstring speed-wise was decreased and he had more control. We do plan on doing another pre and post test as he gets ready to head out to OTAs in order to just see where his body is and to see how much the workout plan, isolating these different issues on both sides, has allowed him to start balancing out his strength and therefore creating a space where he has less risk for injury down the line. Our goal is, again, trying to make sure that he's healthy enough to continue signing these contracts and staying in the sport as long as he so desires, and his body giving him full permission to do that very thing. So I hope this was helpful. I hope this was a good way for you to interpret different results, especially for the chiropractors out there who are trying to see how our treatments go on to help athletes. This is a really good indication that when you do get adjusted, get treated, get worked on regularly as an athlete, you put yourself in a better position that when you are strength and conditioning, you're actually giving yourself the opportunity to start balancing things out. Because our body, again, is going to start doing compensation. It is going to create patterns to help us get through things and to balance us out. So when that's happening, you are putting more pressure on one side than the other. And when you do get worked on, when you get treatment, you relieve that pressure. But then you have to be able to go back in and start building up the strength and balancing out these weaknesses. Because if you don't, your body's only going to continue to do this pattern of compensation and self-balancing, which can only lead to injury down the line. The sooner you can get onto that, the sooner you can make those changes, the better your career is, the better your season is, the better your quality of life is. So I hope this was helpful. I look forward to sharing more tools and more findings as I continue using DorsaVi.